Good afternoon, and welcome to Strides to Solutions podcast. I'm your host, Esther Adams. Today, we're breaking new ground in the equestrian world by opening a long overdue conversation about mental health support for riders and industry professionals. As I sit here today, I can't help but think about the stark contrast I see in mental health support across different sports. On one hand, we have major professional leagues, the NFL, NBA, NHL, and MLB, that have invested millions of dollars in comprehensive mental health programs. On the other, we have our beloved equestrian sports, governed by organizations like the USEF and FEI, operating with virtually no formal mental health infrastructure. This disparity isn't just disappointing, it's dangerous. And today, we're going to explore why it's time for change. Let me paint you a picture of what comprehensive mental health support looks like in professional sports. The NFL, following a joint agreement between the league and the NFL Players Association in 2019, now mandates that every single team employ a licensed mental health clinician available on site for a minimum of 8 to 12 hours per week. These aren't just consultants who show up when there's a crisis. They're integrated into the team's medical staff, providing ongoing support, conducting mandatory wellness education sessions, and developing mental health emergency action plans. The NBA has followed suit with their Mind Health program, requiring every team to have at least one licensed mental health professional on retainer and a psychiatrist available as needed. Teams must establish written action plans for mental health emergencies and ensure strict confidentiality protocols. The message is clear: mental health is treated with the same seriousness as physical health. The NHL's Player Assistance Program, operational since 1996, has evolved from focusing primarily on substance abuse to covering what they describe as everything from alcohol or drug abuse to mental health issues, sleeping problems, or gambling addiction. When a player enters this program, their privacy is paramount. The team and public typically only see a vague announcement about personal reasons. Perhaps most importantly, these leagues have built pathways for athletes to return to competition after addressing mental health challenges. The research I've reviewed shows strong evidence that formal mental health pathways support career continuity and psychological adjustment. Athletes who engage with these programs often show improved long-term career outcomes compared to those who don't receive support. Now, let's talk about our world, the equestrian community. The USEF, our national governing body, offers what amounts to an employee assistance program through a partnership with the McLaughlin Young Group. Members can access up to 3 free counseling sessions per issue through a 24/7 hotline. While this is better than nothing, it's reactive rather than proactive, and it lacks the comprehensive, integrated approach we see in other sports. The USDF, as an affiliate of USEF, essentially piggybacks on these same resources. There are no USDF-specific mental health professionals, no embedded support systems, and no formal pathways for riders struggling with mental health issues to receive ongoing care while maintaining their competitive careers. The FEI, our international governing body, has begun integrating mental wellness into educational initiatives. They've partnered with organizations like Riders' Minds to offer free 24/7 live chat counseling, and they provide mental health toolkits for athletes. But again, this is largely educational and reactive. There's no equivalent to the comprehensive mandated support systems we see in major professional leagues. This gap in support becomes even more concerning when we consider the unique psychological demands of equestrian sport. Research clearly demonstrates that high cognitive load increases a person's capacity to act aggressively or abusively toward others. When individuals are placed under significant mental pressure, multitasking, managing complex situations, dealing with performance anxiety, there to inhibit aggressive impulses becomes weakened. Think about the cognitive demands on an equestrian athlete. They're managing a 1,200-pound animal, making split-second decisions, dealing with unpredictable variables, managing fear, and often carrying the financial burden of an expensive sport. Add to this the pressure of competition, travel fatigue, and the constant evaluation by judges, and you have a perfect storm for compromised decision making. The research I've examined shows that when people are cognitively depleted, when their mental resources have been consumed by demanding tasks, they have fewer resources available to suppress aggressive impulses. This makes post stress aggression more likely. In the context of horse training and care, this could manifest as impatience, harsh training methods, or even abuse. Speaking of abuse, let's address the elephant in the room. Animal abuse is driven by a combination of psychological, social, and situational factors. The research identifies several key risk factors that should concern us in the equestrian world. Callousness and low empathy, poor emotion regulation, and impulse control difficulties are significant predictors of animal abuse. Exposure to family violence, particularly domestic violence, is strongly linked to later animal abuse. Substance use, antisocial behavior, and high stress levels all contribute to increased risk. Here's what's particularly relevant for our discussion. Compassion fatigue among animal caregivers is associated with negative effects such as irritability, reduced empathy, and impaired care quality. While research hasn't established direct statistical links between caregiver fatigue and increased rates of animal abuse, the connection exists through what researchers call compassion fatigue, a combination of emotional exhaustion, secondary traumatic stress, and burnout. The good news? Research shows that animal abuse can be both learned and unlearned. Mental health treatment, including targeted interventions that address trauma, attachment, and emotion regulation, show promise in helping individuals, especially children, change abusive behaviors toward animals. Early intervention and comprehensive mental health support are theorized to facilitate faster and more sustainable behavioral change. But why don't we have these systems in place? The answer lies in both economics and culture. Professional sports leagues operate with massive budgets and collective bargaining agreements that can mandate mental health support. The NFL generates about $15 billion annually, the NBA around $12 billion. They can afford embedded mental health professionals for every team. Equestrian sport operates differently. We're largely an individual sport with a decentralized structure. There's no collective bargaining unit fighting for rider mental health benefits. The economic model doesn't support embedded professionals at every barn or competition. Culturally, equestrian sport has long prized mental toughness and self reliance. We've inherited a cowboy up mentality that views seeking help as weakness rather than strength. This cultural barrier may actually be our biggest obstacle to change. So, where do we go from here? Do you believe it's time for the USEF and FEI to implement comprehensive mental health programs that go far beyond what currently exists? Here's what this could look like. First, we need formal mental health pathways that support both career continuity and provide clear routes back to competition for riders who step away to address mental health challenges. The research shows these pathways don't just help individual athletes, they benefit the entire sport by creating a culture where seeking help is normalized. Second, we could mandatory mental health education for all professional riders, trainers, and officials, just as we require safe sport training, which is a conversation on its own. We should require annual mental health literacy education that covers recognizing signs of distress, understanding the connection between mental health and animal welfare, and knowing how to access resources. Third, we could to establish a network of equestrian specialized mental health professionals. These wouldn't need to be embedded at every barn like in professional leagues, but they should understand our sport, our culture, and our unique stressors. They should be available through a centralized system and work with riders throughout their competitive careers, not just in crisis situations. Fourth, we could have formal reinstatement protocols for riders who have been suspended for conduct that may be related to mental health issues. Currently, if someone is suspended for animal abuse or other misconduct, they simply serve their suspension and return, or perhaps pay a fine. There's no requirement for mental health evaluation, no treatment pathway, no support system to address the underlying issues that may have contributed to the problematic behavior. The evidence supporting this approach is overwhelming. Studies show that early intervention frameworks and comprehensive mental health support facilitate faster and more sustainable returns to competition. They reduce the risk of repeat offenses and support long-term career success. More importantly, mental health interventions can break the cycle of abuse. Research on animal abusers shows that those who receive mental health treatment can experience psychological healing, particularly when interventions address underlying issues like empathy deficits, trauma histories, and emotion regulation problems. For youth in our sport, the evidence is even stronger. Animal assisted play therapy and similar approaches show promise in helping children who have witnessed or experienced family violence, children who might otherwise be at risk for developing abusive behaviors themselves. We can't ignore substance use in this conversation. Higher alcohol consumption is linked to increased animal abuse risk, and substance use disorders often co-occur with mental health challenges. Professional leagues have learned that treating substance use as a health issue rather than solely a disciplinary matter leads to better outcomes. The research shows that individuals with substance use disorders who receive comprehensive treatment, including mental health support, are more likely to maintain sobriety and avoid repeat offenses. This model could be transformative in equestrian sport, where substance use policies currently focus primarily on punishment rather than rehabilitation. Perhaps most importantly, we need to change our sports culture around mental health. In the NHL, Commissioner Gary Bettman noted that increased utilization of their assistance program is actually viewed as a positive sign. It means players trust the system, and stigma is decreasing. We need to reach that same point in equestrian sport. This means having prominent riders, trainers, and officials speak openly about mental health challenges. It means celebrating those who seek help rather than viewing them as weak. It means recognizing that taking care of our mental health is as important as taking care of our horses. The FEI has begun to recognize this need. Their recent emphasis on athlete welfare includes mental health components, and they've started providing guidance for competition organizers on mental health support at events. However, this is still largely educational rather than systematic. What we need is an international standard, a requirement that major competitions provide mental health resources, just as they provide veterinary care for horses. We need mental health professionals who understand equestrian sport available at major championships, Olympics, and World Equestrian Games. I know some of you are thinking, but Esther, we're not professional athletes with multi-million-dollar salaries. How can we justify this level of support? My response is simple. We're asking people to partner with 1,200-pound animals in high-stress situations. We're asking them to travel extensively, compete under pressure, and make decisions that affect both their safety and their horse's welfare. The stakes are actually higher in many ways than in traditional sports because animal welfare is directly involved. Moreover, the cost of not providing support is significant. Think about the damage to our sport's reputation when abuse cases make headlines. Think about the talented riders we lose when they burn out or develop serious mental health conditions without support. Think about the horses that suffer when their handlers are struggling emotionally. The research on compassion fatigue shows that supporting caregivers ultimately benefits the animals in their care. When we support the mental health of riders, trainers, and grooms, we're directly supporting horse welfare. One advantage we have in 2025 is technology. We don't necessarily need an embedded psychologist at every barn. We can create virtual networks of support, 24/7 telehealth options, and mobile apps designed specifically for equestrian athletes. The Western Sports Foundation, which supports rodeo athletes, has partnered with BetterHelp to offer unlimited one-on-one therapy sessions via phone, video, or text. This model could be adapted for our discipline, providing comprehensive support without the geographic limitations that often plague rural equestrian communities. We have a particular responsibility to young riders. The research clearly shows that adverse childhood experiences, including witnessing animal abuse, increase the risk of developing abusive behaviors later in life. By providing comprehensive mental health support to junior riders, we're not just supporting their competitive careers, we're potentially preventing future abuse. Youth who receive early mental health support and learn healthy coping strategies are less likely to develop substance use disorders, less likely to engage in animal abuse, and more likely to have successful long term careers in the sport. Let's also talk about performance. Mental skills training and psychological support aren't just about preventing problems, they're about optimizing performance. Professional athletes have long understood that mental training is as important as physical training. Research in sports psychology consistently shows that athletes who receive mental skills training perform better under pressure, recover more quickly from setbacks, and have longer, more successful careers. In a sport where the margin for error is measured in millimeters and seconds, this kind of support could be the difference between success and failure. I want to be realistic about implementation. The USEF and FEI don't have NBA level budgets, but they don't need them. A comprehensive mental health program for equestrian sport would cost a fraction of what professional leagues spend, and it could be funded through a combination of federation resources, sponsor support, and member fees. Consider that a single embedded mental health professional costs roughly $100,000 to $150,000 annually. The NFL, with 32 teams, spends roughly $3 to $5 million per year on this mandate. The USAF could create a network of 10 to 15 equestrian specialized mental health professionals for less than $2 million annually. A significant investment, but not an impossible one. This brings me to one of the most important questions we're exploring today. Should the USEF and FEI institute formal mental health pathways for reinstatement after misconduct? The evidence strongly suggests yes. Current research shows that while formal mental health pathways are strongly linked to better long term career continuity and psychological well being, there is limited direct evidence on their effect on time to reinstatement. However, early intervention and comprehensive support are theorized to facilitate faster and more sustainable returns by addressing psychological barriers, reducing stigma, and promoting readiness for reintegration. More importantly, without these pathways, we're essentially ensuring that problems will recur. If someone engages in animal abuse due to underlying mental health issues, substance abuse, or poor coping skills, simply suspending them for a period of time does nothing to address the root causes. They return to competition with the same problems they had before, problems that are now likely worse due to the stress and stigma of suspension. A formal reinstatement pathway would require comprehensive evaluation, treatment compliance, and ongoing monitoring. It would ensure that individuals returning to competition have developed better coping strategies and support systems. Most importantly, it would send a message that our sport takes both accountability and rehabilitation seriously. Looking globally, some equestrian federations are ahead of the curve. Equestrian Canada points its athletes to mental health resources and highlights sports psychology tools. Equestrian Australia has launched a mental health in sport awareness and action program to train coaches and high performance staff in recognizing and responding to mental health concerns. These efforts reflect a growing consensus at the national level that wellness and performance go hand in hand, and that providing accessible, confidential mental health support is key to athlete longevity and success. One challenge we face is the lack of comprehensive data on mental health issues in equestrian sport. Professional leagues can point to utilization rates, outcome measures, and return to play statistics. We need to start collecting similar data in our sport. This means tracking mental health service utilization, monitoring outcomes for individuals who receive support, and measuring the impact of interventions on both performance and welfare. We need to understand the scope of the problem before we can fully address it. One element that's been particularly successful in professional leagues is peer support. The NHLPA's First Line program, launched in partnership with the Mental Health Commission of Canada, provides peer to peer mental health training. Players learn to recognize warning signs in themselves and teammates and are encouraged to have open conversations that break down stigma. This model could be incredibly powerful in equestrian sport, where relationships between riders, trainers, and grooms are often very close. Training our community members to recognize signs of distress and know how to respond could create a network of support that extends far beyond formal mental health services. Throughout this discussion, I want to emphasize that supporting rider mental health is inseparable from supporting horse welfare. The research is clear that stressed, fatigued, or emotionally compromised caregivers provide poorer care to animals. Conversely, caregivers who receive mental health support are more attentive, more emotionally regulated, and make better decisions about animal care. Every dollar invested in rider mental health is an investment in horse welfare. We also need to consider the mental health needs of trainers, coaches, and other equestrian professionals. These individuals often carry enormous responsibility for their students' safety, their horses' welfare, their business's success, and their own competitive careers. The research on compassion fatigue shows that this population is at particular risk for burnout, secondary trauma, and emotional exhaustion. Yet they often have even fewer resources than riders. A comprehensive mental health program would need to address their needs as well. Equestrian sport often involves entire families, parents who sacrifice financially, siblings who grow up at horse shows, spouses who support competitive careers. These family members can be sources of support, but they can also be additional stressors. A truly comprehensive mental health program would recognize that equestrian athletes exist within family systems and would provide resources for family members as well. This might include family counseling, parent education about the psychological demands of equestrian sport, and support for family members dealing with their own stress related to the sport. We can't ignore the financial stress that characterizes much of equestrian sport. Unlike professional athletes with guaranteed salaries, most equestrian competitors are financially stressed. They're often spending more than they can afford, taking on debt, or making significant sacrifices to continue competing. This financial stress is a major mental health risk factor. It contributes to anxiety, depression, relationship problems, and poor decision making. Any comprehensive mental health program would need to address financial counseling and stress management related to the economic realities of equestrian sport. Professional leagues have recognized that athlete retirement and career transitions are major mental health challenges. Many athletes struggle with identity loss, depression, and adjustment difficulties when their competitive careers end. This is equally true in equestrian sport, but we have even fewer resources for riders transitioning out of competition. A comprehensive mental health program would include transition planning, career counseling, and ongoing support for former competitors. Equestrian sport has a predominantly female participation rate, which creates both opportunities and challenges for mental health programming. Research shows that women and girls are more likely to seek mental health support, but also face different types of stressors and mental health challenges. A gender-informed approach to mental health programming would recognize these differences and ensure that services are designed to meet the specific needs of our predominantly female population. Competing internationally adds another layer of psychological complexity. Travel fatigue, cultural differences, separation from support systems, and the pressure of representing one's country. The research on jet lag and cognitive performance shows that international travel can significantly impact mental functioning and decision making. Mental health support for international competitors would need to address these specific stressors and provide coping strategies for the unique challenges of global competition. Today's equestrian athletes face stressors that previous generations never encountered: social media scrutiny, online criticism, and the pressure to maintain a perfect public image. Research shows that social media use can contribute to anxiety, depression, and poor self image, particularly among young athletes. A modern mental health program would need to address digital wellness, social media management, and helping athletes develop healthy relationships with technology and online presence. Equestrian sport has a high rate of head injuries, and emerging research shows strong connections between traumatic brain injury and mental health problems. Athletes who have suffered concussions are at higher risk for depression, anxiety, and cognitive problems. A comprehensive mental health program would need to include specialized support for athletes dealing with post concussion symptoms and ensure that mental health screening includes assessment for brain injury effects. While we may not like to admit it, substance use is present in equestrian sport just as it is in other high stress environments. Alcohol use for stress management, prescription drug misuse for pain and anxiety, and recreational drug use all occur in our community. The research shows that treating substance use as a health issue rather than solely a disciplinary matter leads to better outcomes. Professional leagues have learned that providing treatment and support is more effective than punishment alone. The COVID-19 pandemic provided a natural experiment in mental health support across sports. Those leagues and organizations with robust mental health programs were better able to support their athletes through the crisis. Those without such programs saw increased rates of mental health problems, substance use, and behavioral issues. The pandemic also demonstrated the effectiveness of telehealth and virtual support services, showing that comprehensive mental health support doesn't require physical proximity between providers and athletes. One question that arises is whether to focus resources on prevention or intervention. The research suggests that both are necessary, but prevention is more cost effective and leads to better outcomes. Primary prevention would include mental health education, stress management training, and building resilience skills. Secondary prevention would involve early identification and treatment of emerging problems. Tertiary prevention would focus on preventing relapse and supporting recovery. How do we measure success in mental health programming? Professional leagues track utilization rates, satisfaction scores, and outcome measures like return to play rates and repeat offense rates. In equestrian sport, we might measure things like rider retention rates, competition performance stability, incident rates and severity, career longevity, satisfaction with mental health resources, knowledge and attitudes about mental health. The training and certification question: if we're going to have equestrian specialized mental health professionals, how do we ensure they're properly trained? This would require developing specialized training programs, certification requirements, and ongoing education about the unique aspects of equestrian sport. Professional development would need to cover topics like the psychology of human animal relationships, risk assessment in equestrian environments, cultural competence in equestrian sport, trauma informed care for athletes, substance abuse in athletic populations, the legal and ethical considerations. Implementing comprehensive mental health programs raises important legal and ethical questions about confidentiality, mandatory reporting, fitness for competition, and liability. These issues aren't insurmountable. Professional leagues have developed frameworks that protect both athlete privacy and sport integrity, but they require careful consideration and clear policies. Implementing comprehensive mental health programs would create unprecedented research opportunities in equestrian sport. We could study questions like what mental health interventions are most effective for equestrian athletes? How does mental health support impact performance and career longevity? What are the specific risk factors for mental health problems in equestrian sport? How can we best support the mental health of young riders? What role does human-animal bonding play in psychological well-being? If the FEI implemented comprehensive mental health standards, it would set a global precedent that could transform equestrian sport worldwide. National federations would be encouraged or required to develop their own programs, creating a universal standard of care for equestrian athletes. This could be part of the FEI's broader emphasis on athlete welfare and could demonstrate global leadership in sports psychology. So, where does this leave us? We've established that major professional sports leagues have comprehensive mental health programs that support both performance and welfare. Equestrian sport currently lacks these systems despite facing unique psychological challenges. Research supports the effectiveness of formal mental health pathways for athletes. The consequences of not providing support include both human suffering and animal welfare concerns. Implementation is challenging but not impossible. The question isn't whether we should develop comprehensive mental health programs for equestrian sport. The question is how quickly we can make it happen. This is where you come in, our equestrian community. This podcast is designed to open dialogue, not to provide all the answers. I want to hear from you. Riders, what mental health challenges do you face? What support would be most helpful? Trainers, how do you support the mental health of your students? What resources do you need for yourself? Parents, how do you help your young riders manage the psychological demands of the sport? Officials and administrators, what barriers do you see to implementing mental health programs? Mental health professionals, how can we better serve the equestrian community? The immediate steps. While we work toward comprehensive programs, there are things we can do right now. Use the resources that exist, USEF's counseling hotline, crisis lines, local mental health providers. Talk openly about mental health in our barns and at competitions. Support riders who step away from competition for mental health reasons. Advocate with our national federations for improved mental health resources. Seek additional education about mental health and horse welfare connections. Imagine an equestrian sport where every major competition has mental health professionals available. Riders feel comfortable seeking help without fear of stigma or career consequences. Young riders learn mental skills alongside riding skills. Trainers are equipped to recognize and respond to mental health challenges. Clear pathways exist for riders to return to competition after addressing mental health issues. Mental health is valued equally with physical health. Horse welfare is protected through better support for human caregivers. This isn't just a dream, it's an achievable goal if we commit to making it happen. We need more research specifically focused on mental health in equestrian sport. While we can apply general sports psychology research, our sport has unique characteristics that deserve specific study. The impact of human animal bonding on mental health, risk factors specific to equestrian environments, effective interventions for equestrian athletes, the relationship between rider mental health and horse welfare, cultural factors that influence help seeking in equestrian sport. This research would provide the evidence base needed to design optimal mental health programs for our community. Any comprehensive mental health program must include education components, basic mental health literacy for all participants, recognizing signs of distress in oneself and others, understanding the connection between mental health and performance, knowing how to access resources, reducing stigma around help seeking, building resilience and coping skills. This education should be mandatory, ongoing, and age appropriate, just like our current safe sport requirements. Ultimately, what we're talking about is a cultural transformation in equestrian sport. We need to move from a culture that prizes stoicism and self reliance above all else to one that values holistic well being and recognizes that seeking help is a sign of strength. This transformation won't happen overnight, but it can happen. We've seen it in professional sports, in healthcare, in education, and in many other sectors. Equestrian sport can and should be next. As we wrap up this episode of Strides to Solutions, I want to emphasize that this is just the beginning of our conversation. Mental health in equestrian sport is a complex topic that deserves ongoing attention and dialogue. Equestrian sport has an opportunity to be innovative in mental health support. We could develop models that other sports adopt. We could create programs specifically designed around the human-animal bond. We could use technology in new ways to provide support in rural and isolated environments. This isn't just about catching up to other sports, it's about leading the way in athlete mental health support. Every stakeholder in equestrian sport has a role to play in improving mental health support. Federations need to provide leadership, resources, and programming. Competitions need to ensure mental health resources are available. Trainers need education and support to help their students. Parents need to understand and support their children's mental health needs. Sponsors could support mental health programming. Media could help reduce stigma through responsible reporting. All of us need to change the conversation around mental health in our sport. The research evidence supporting comprehensive mental health programs in sport is overwhelming. We know these programs work. We know they improve both performance and welfare. We know they save careers and possibly lives. We know they protect animal welfare. The question isn't whether the evidence supports action. It clearly does. The question is whether we have the will to act on that evidence. Finally, let's consider the cost of not taking action. Every year, we delay implementing comprehensive mental health support. We lose talented riders who burn out or develop serious mental health conditions. We see preventable incidents of animal abuse. We perpetuate a culture of suffering in silence. The human cost is immeasurable. The impact on horse welfare is significant. The damage to our sport's reputation continues to accumulate. We cannot afford to continue down this path. As we close today's episode, I'm issuing a call to action to our entire equestrian community. Start the conversation in your barn, your club, your competition community. Contact your national federation and ask what they're doing about mental health support. Support riders who seek mental health help instead of stigmatizing them. Educate yourself about mental health and its connection to horse welfare. Share your story. If you've struggled with mental health in our sport, consider sharing your experience to help others. Advocate for change at every level of our sport. The future of equestrian sport can and should include comprehensive mental health support for all participants. We can create a sport culture where mental health is valued equally with physical health. Seeking help is seen as responsible and strong. Resources are available to all participants regardless of economic status. Clear pathways exist for those who need to step away and return. Horse welfare is protected through better support for human caregivers. Performance is optimized through mental skills training. Careers are prolonged through proper mental health support. Young riders learn healthy coping skills alongside riding skills. This future is possible, but only if we commit to making it happen. Today, we've opened a door that has been closed far too long in equestrian sport. The conversation about mental health support for riders, trainers, and other industry professionals is not just important, it's essential. The research is clear. Formal mental health pathways support career continuity and psychological adjustment. They help prevent problems and provide solutions when challenges arise. They benefit not just individual athletes, but the entire sport community. Major professional sports leagues have shown us what comprehensive mental health support looks like. They've demonstrated that these programs work, that they're worth the investment, and that they can transform sport culture for the better. Now it's time for equestrian sport to follow suit. It's time for the USEF, FEI, and national federations around the world to recognize that mental health support isn't a luxury, it's a necessity. The path forward isn't easy, but it's clear. We need comprehensive programs that include prevention, intervention, and long-term support. We need professional networks specifically trained in equestrian sport psychology. We need formal pathways for reinstatement that address underlying issues rather than simply punishing symptoms. Most importantly, we need a cultural shift that values mental health as highly as we value riding ability, horse care, and competitive success. This is just the beginning of our dialogue. I want to hear from you, the riders, trainers, parents, officials, and mental health professionals who make up our equestrian community. Share your thoughts, your experiences, your ideas, and your concerns. Let's build this conversation together and create the change our sport so desperately needs. Remember, seeking help isn't a sign of weakness, it's a sign of wisdom. Taking care of your mental health isn't selfish, it's responsible. And advocating for better mental health support in our sport isn't optional, it's essential. Thank you for joining me for this inaugural episode of Strides to Solutions. I'm Esther Adams, and I look forward to continuing this vital conversation with all of you. Until next time, take care of yourselves, take care of your horses, and let's work together to create positive change in equestrian sport.